8 signs your thyroid is crying out for help. In this video, I'll teach you how to identify this disease that is so common, not only hypothyroidism, but also hyperthyroidism. And I wanted to point out that this video is valid for people who are already taking thyroid hormone or medication like tapazole and propylthiouracil, but also for people who have not yet been diagnosed. So it's relevant to both groups. It's a question you always ask. What's the importance of this video? About 10% of the population in some groups, such as women, this can reach up to 15%, 15 to 20% of thyroid changes. So you can imagine the relevance and how many people do not have this disease. It's estimated that 25% of people who have thyroid disease don't know they have this type of problem and how common it is. If you pay attention to these signs, you will be able to identify it and also seek help. Get tested. At the end of the video, for those of you who are most engaged, I'll give you 2 bonus tips. They're not signs, but you should pay extra attention to them. The first sign that your thyroid is calling for help is pain, tenderness, or a change in the shape of your thyroid. I'm going to explain how to evaluate that in this video. All you need is a glass of water and a mirror. You can take the test right there at home. Of course, it doesn't replace a doctor's appointment, but it's a way for you to do a thyroid self-exam, because your thyroid may be asking for help. Why might the shape change? Well, for example, if you have a nodule, you'll notice that one side of your thyroid may be larger than the other, and in hypothyroidism, when your thyroid doesn't produce thyroid hormones properly, the lack of thyroid hormones can cause it to grow or increase in size because the body perceives this and stimulates the thyroid to grow through TSH. And with hyperthyroidism too, since it has a lot of functions, the excess of thyroid hormones can make it enlarged, which is also a cause of goiter. So pay attention to sensitivity and pain. To do this test now, stand in front of the mirror, get a glass of water, and identify 3 structures. First, the notch by the laryngeal prominence, which in men is also called the Adam's apple. Right below that, you have the cricoid cartilage, and then there's the thyroid, which is in this area here. So to evaluate, she takes a sip of water and looks at the movement she's making in the mirror. You can compare the 2 sides. There shouldn't be any pain or tenderness with this test, and you can see if one side is larger than the other. It could be a nodule, for example, or even if the thyroid looks very prominent, if it's bulging out. This is called outward growth of the thyroid. This is an easy way for you to do a self-check. Also, do it in your family so you can get help quicker. Now, the second sign that the thyroid may be asking for help is indeed changes in memory lapses, forgetfulness. If you forgot to like the video, it could also be a sign of thyroid disease. So like it now, I didn't mention it in the video. Let's make a goal of 3,000 likes. This content is extremely important and needs to be disseminated. And the third sign is the sign of hypothyroidism. This sign is very common. I've talked about this, but you saw that 25% of people, about a quarter, don't know they have a thyroid diagnosis, so they should contribute. But this particular sign is very frequent. Almost 100% of people have it in the diagnosis, talking to patients, even if you already have a diagnosis of hypothyroidism. So it's a very important sign. You should always evaluate memory changes. This has to be linked with thyroid disease because thyroid hormones also act in the central nervous system in our brain on the connections, and even if you don't treat it, it can lead to dementia, a treatable and reversible cause if you treat it in the early stages of dementia. So look at the importance of this video. The third sign that your thyroid is crying out for help, and here is a controversial topic, weight. Many people talk like this, but they say that the thyroid doesn't make you fat. So why is there this controversy? In the diagnosis of hypothyroidism, on average, you will have a weight gain of between 2 and 4 kilos. So yes, there is this relationship. Not everyone is going to gain 20. Why? Because it slows down your metabolism, you become more lethargic, less inclined to exercise, more bloated, and this weight gain could also be due to water retention. So there definitely is a relationship there. And in hyperthyroidism, that relationship's even greater. Why? Because you shed lean mass. Hyperthyroidism, when you have too many thyroid hormones, does indeed cause weight loss, including severe weight loss. So pay close attention to changes in weight. Let me put it this way. When you've already started losing weight, seek help right away. Don't wait and see if you'll get better, because it's much easier to treat in the early stages. And the prognosis, the chance of a cure, for example, is also better. So look out for our third sign. The fourth sign that your thyroid's calling for help is swelling. You can see it especially in the lower limbs, in the legs, due to gravity. So it's easiest to assess in the shin area, the ankle area. You can see it there. See it. Another easy way to spot it is by your footwear. You go, these shoes don't seem to fit right, so pay special attention to that. When this reduction in hormones becomes more noticeable, you can also have swelling in other parts of the body, fluid retention like on your face, especially around the eyes. So pay close attention if you're bloated. You also need to seek medical help. And the fifth sign, sign number 5, if your thyroid could be diseased, is changes in libido. But what does the thyroid have to do with changes in libido? Because it can affect the production of other hormones, like testosterone, for example. It can increase prolactin, and it can even cause galactorrhea, which is milk coming out of the nipple. Not just in women, but men can have this too. Sometimes diagnosis in men is made because of this sign as they seek help. People, what is this? How can milk be coming out? So if you check and you have thyroid disease, excessive TSH production ends up stimulating a hormone called prolactina, and this causes galactorrhea. So changes in libido and also a reduction in testosterone. Taking this opportunity in women, changes in the menstrual cycle, even some symptoms of premature menopause, you should always assess thyroid function. And the sixth sign that your thyroid is crying out for help is precisely changes in other diseases. So you had controlled blood pressure, then started to have increased pressure. You have diabetes, and your blood sugar was good. Hemoglobin A1C was at stable levels. You were successfully controlling your disease. Then all of a sudden, you see that it started to lose control. You don't know the cause. Pay attention, because the thyroid may be crying out for help. So you always have to evaluate changes in the thyroid. Arthritis, rheumatoid. Also, you had controlled joint pain. It got a lot worse. Changes in the bowel. You were very constipated. Got better and now are constipated again. So give special attention to the thyroid, because it can also affect other diseases, even aggravating treatments. And the seventh sign that your thyroid needs help is precisely hair loss. Often patients even take multivitamins. Think of other causes and don't consider the thyroid. Men generally don't care much about hair. Now men are calling, but women often get diagnosed with thyroid problems precisely because of hair loss, because it's a sign that bothers them a lot. So the woman goes to seek help and gets diagnosed with a thyroid problem. Here, the two opposite diseases, hyperthyroidism and hypothyroidism, have this sign in common. So there is a strong relationship indeed. The eighth sign that your thyroid needs help. I'm still going to tell you those 2 tips that I promised at the beginning of the video. But the last sign is indeed fatigue, muscle pain, weakness, tiredness. So pay attention to that. What parameter are you going to have? It's on you, so you'll be able to climb up to 4 flights of stairs. For instance, right now you can only manage 2 before you're exhausted, gasping for breath. Be careful, this could be a sign that your thyroid is sick. This symptom isn't talked about as much, body aches, but I've noticed that it's quite common in patients who either have hyper or hypothyroidism to report muscular pains. As for fatigue, use yourself as a gauge. And these 2 signs or hints I'm about to give you are not just signs. They're specifically tied to the illness, and you need to pay even more attention to them. Specifically, the first one. If you have any family members who have a thyroid condition, not necessarily autoimmune, but conditions like thyroid cancer, hyperthyroidism, hypothyroidism, any type of thyroid disease, we already know these can be hereditary. So pay extra close attention to this. Be doubly careful. Another thing to consider is if you have autoimmune diseases like type 1 diabetes, for example, if you have vitiligo, if you have alopecia areata, for example, pay very close attention. Rheumatoid arthritis, celiac disease, any type of autoimmune disease will increase your chances of having a thyroid disorder, you having a thyroid like Hashimoto's, you having Graves' disease. So this is the second bonus tip. If you like this video, don't forget to like it. And now I'm going to leave a suggestion for those who use the thyroid hormone. There are 8 essential tips for those who use levothyroxine. It's this video here. Don't miss out on watching it.